routine catheter care.
Hi, I'm Jamie Bervano and I will be performing the routine catheter care. So the first thing that you need to do, of course, is the assessment, which is you need to assess the client's ability to cooperate with the procedure. So the rationale of that is you need to determine how the procedure will be carried out. Then, after that, of course, you need to determine or you need to assess the working area if it is well lit. And it is in order to determine what preparation needs to be done in order to be ensured the successful procedure. So next is, of course, the planning. You need to prepare all the materials, supplies needed for the procedure, which is, the first is antiseptic solution. I have it here. And then the sterile swabs, clean gloves, the soap and water, and washcloth. So I have it here, all the materials. It is necessary, it is in order to organize materials which it is easy to access during the procedure. So going to the implementation, the first thing that you need to do is to identify client and explain the purpose of doing the procedure. Then, the rationale of that, it is in order to alleviate the anxiety and gains the cooperation of the patient. Then, next is you need to provide the client's privacy by closing the door and also the curtain. It is in order to protect the client's dignity. And of course, you don't need to forget to wash your hands before doing the procedure. It is in order to reduce that transmission of microorganisms. Then, next is you need to check the institutional protocol or care plan. It is to ensure the proper procedure as well. And is you need to place the client in supine position and expose the perineal area in the catheter. So, ma'am, I will be cleaning your perineal area in order to prevent the spreading of the microorganism within the area or within the catheter. Then, after that, of course, you need to put on the clean gloves before cleaning the perineal area of the patient. So after you put the gloves, you need to clean the perineal area with soap and water. So I have here the water and also the cloth. So I will press it on the water and then put some soap. So the soap has antibacterial qualities adequate to clean the area, and it will not usually irritate the skin or mucous membrane. So for female client, the first thing that you need to do is to separate the labia, cleanse from front to back, begin in the center, then clean each side. So, every section of the cloth, you need to clean each side. So, every stroke of this one, you need to clean every side of the labia of the female client. And if there is a drainage, use a non-irritating antiseptic solution on a cotton ball or even in a cotton swab. So I will clean it using the first layer from center, and then the second layer, okay, and the third, okay. So I will dispose it. The rationale of that, it is cleaning the most clean to the least. It is clean decreases the risk of urinary tract infection or diseases, which code as UTI. So of course, after cleansing the labia, the next thing you will do is cleanse the catheter. You need to hold the catheter tubing, taking care not to pull on the catheter. Begin at the meatus and cleanse toward end of the catheter. So, of course, I have it again here, the cloth. Put some water, put some soap, Because cleaning from most to least clean decreases the risk of urinary tract infections or the UTI. So trauma to the urethra and bladder are decreased when the catheter tubing is not pulled. Again, using the first stroke, you hold this one in order not to move. Okay? And then the next one, hold the catheter and then clean it. And then the third stroke, need to hold it and then clean again the catheter. And then dispose it. So be sure to repeat the catheter care anytime. So it becomes solved with stool or other drainage. So it is in order to prevent infection. And then you need to rinse and dry the genitals and also the perineum. So I have here the cloth which is dry. This one. Using again the 3 strokes of the cloth. Okay. So from center, third, and each side. And then the third one. Okay. And then dispose it. And then, so after that, of course, the catheter as well. So hold the catheter and then clean it. And then the second stroke, hold the catheter and then clean it. And then the last one part is this one, hold the catheter and clean it again. Then dispose it. So after that, you need to place the linen or cotton balls in proper receptacle for laundry or disposal. So after that, you need to remove the gloves. In order to place the linen, it is because to reduce the transmission of microorganisms, just like washing your hands. So after that, of course, the evaluation, you need to document all the findings or after you've done the procedure to the patient in order to have the accurate for all collaborative management and continuity of care.